squeaking rubber soles against cheap linoleum, a crushed needle cap wedged beneath a rolling stool. Panic smells like burnt coffee and stale sweat drowning out the monitor alarms. Survival doesn't live in the screaming chaos. It hides in the quiet, brutal pauses between heartbeats, just waiting for a mistake. Fluorescent lights hummed a relentless flat note above Trauma Bay 3. Harper pressed a square of sterile gauze against a drunk college student's split forehead, holding it there with exactly 3 pounds of pressure. She didn't look at the kid's face. She watched the wall clock. The second hand ticked past the 12, dragging her further into the 2 a.m. slump. "You're going too slow, Harper. We need this bay cleared 10 minutes ago." Brenda's voice cut through the hum. The charge nurse stood in the doorway, a tablet resting on her hip, her face pinched into a permanent scowl of administrative disapproval. Brenda smelled like vanilla hand sanitizer and cheap peppermint gum. It was a cloying mix that always made Harper's throat tighten. "Almost done," Harper said. Her voice was flat, devoid of the defensive upward inflection new nurses usually adopted. She peeled the gauze back. The bleeding had stopped. She reached for the Dermabond, her fingers steady, moving with a deliberate, maddening economy of motion. She didn't fumble. She didn't rush. "I don't know how they trained you at that community clinic." Brenda sighed, stepping into the room and invading Harper's personal space. Brenda's elbow brushed Harper's shoulder. Harper's right hand twitched a millimeter of movement, her knuckles whitening around the tiny tube of surgical glue. She forced the muscle to relax. "But at County General, we hustle. You're moving like you're underwater." "Understood." Harper finished gluing the laceration. She didn't offer a forced smile. She didn't apologize. She tossed the empty tube into the biohazard bin with a soft thwack and turned to the sink to scrub her hands. The water ran cold over her skin. She stared at her knuckles. They were thick, the skin over the joints slightly discolored, carrying faint silvered scars that didn't come from paper cuts or clumsy IV starts. Behind her, she heard Brenda mutter to one of the techs in the hall. "I swear she's medicated, half asleep. Dr. Hayes asked her for a crash cart yesterday, and she just stared at him for 2 seconds before moving." Harper shut off the faucet. The paper towel dispenser jammed. She ripped the wet paper out with a sharp, violent tug, drying her hands until the cheap brown material shredded against her palms. She wasn't medicated. She was just trying to turn the volume down. Civilian ERs were loud, unnecessarily loud. Doctors yelled orders to prove they were in charge. Nurses gossiped over the agonizing groans of patients in the hallway beds. The monitors beeped incessantly for low batteries or loose leads, creating a symphony of false alarms that made Harper's teeth ache. For the first 3 months, the lack of discipline had made her physically nauseous. When a monitor alarmed, her body primed for a fight, dumping adrenaline into her bloodstream. But it was never a mortar strike. It was never a collapsed lung in a pitch-black helicopter. It was just Mrs. Higgins ripping off her pulse oximeter again. So Harper had built a wall. She moved deliberately. She spoke only when necessary. She became invisible. And in the high school hierarchy of the ER night shift, invisibility was a weakness. It made her a target. She walked out to the central nurses' station. Dr. Hayes was leaning against the counter, a lukewarm coffee in his hand, laughing at something a young blonde float nurse named Chloe was saying. Hayes was a second-year attending. He wore tailored scrubs and had the unearned confidence of a man who had never been punched in the mouth. "Here she comes," Hayes muttered, not quite low enough. "The tortoise," Chloe giggled, pressing a hand to her collarbone. Be nice, Greg. She's trying. Harper sat down at a computer terminal on the edge of the desk, pulling up her charting. She ignored them. She felt the heavy, stifling heat of the room, the scratch of her polyester uniform pants against her calves. She wanted a cigarette, and she hadn't smoked in 4 years. "Hey, Harper," Hayes called out. "You managed to glue that frat boy back together without passing out from the excitement. Patient in Bay 3 is ready for discharge," Harper said to the screen, typing her notes with rapid, heavy keystrokes. "Right. Fantastic." Hayes rolled his eyes at Chloe. "If we get a real trauma tonight, do me a favor. Harper, stay out of the way. I need people who can think on their feet, not people who need a written invitation to grab a tourniquet." Harper stopped typing. The cursor blinked on the glaring white screen. A heavy dark pressure pushed up against the base of her skull. It would be so easy. It would take exactly 2 seconds to stand up, grab Hayes by the collar of his expensive scrubs, and explain to him exactly what a real trauma looked like. She could tell him about the smell of vaporized copper and burnt hair. She could describe the slick, impossible heat of holding a man's femoral artery shut with her bare hands in the back of a lightless transport tearing through the Afghan desert. She swallowed. It tasted like ash. "I'll keep that in mind, doctor," she said evenly. She didn't look at him. She just went back to typing. Let them think she was slow. Let them think she was stupid. It was safer this way. If she let the anger out, if she let the old Harper out, the chief petty officer, the SOCOM attached medic who broke a man's jaw for questioning her triage orders in Fallujah, she wouldn't be able to put her back in the box. And she needed the box. The box kept the nightmares at a manageable distance. The shift turned at 3:15 a.m. It didn't start with a siren. It started with a low, vibrating rumble that rattled the plastic blinds against the break room windows. Harper felt it in the soles of her shoes before she heard it. An industrial boiler explosion at the meatpacking plant 4 miles down the interstate. The red emergency phone at the charge desk shrieked. Brenda snatched it up, her annoyance shifting instantly into wide-eyed panic as she listened. "How many?" she barked, her voice cracking. "We only have 3 trauma bays. No divert to Mercy. You can't." She slammed the phone down, her face pale. "Mass casualty," Brenda yelled, her voice piercing the dull hum of the ER. 6 rigs incoming. Crush injuries, massive burn, shrapnel. ETA 2 minutes. Clear the halls. Hayes, get the airway kits. ET. The ER shattered into chaotic motion. Chloe dropped a stack of charts, the plastic binders clattering loudly against the floor. Orderlies began shoving empty gurneys into the hallways. Dr. Hayes sprinted toward the supply closet, his face flushed, dropping a box of gloves in his haste. Harper didn't run. She stood up, pushing her chair in. The heavy pressure at the base of her skull vanished, replaced by a cold, crystalline clarity. The noise of the room, the shouting, the clattering, the rising panic faded into a dull, manageable static. Her heart rate actually dropped. The double doors of the ambulance bay blew open. The smell hit first. Scorched denim raw meat and the unmistakable sweet iron tang of massive hemorrhage. It was a smell that belonged in a war zone, not a sterile hospital in the Midwest. Paramedics rushed in, shouting over each other. Male 40s caught behind the blast wall. "Pulse is thready. He's lost a lot of fluids. I need an airway over here. His throat is swelling shut." Hayes lunged toward the first gurney, a man with his chest torn open by flying sheet metal. "Get him in Bay 1. I need lines. I need O-neg." Hayes was shouting too loud. His voice was high, frantic. Harper bypassed Bay 1. She saw the second gurney rolling in. A younger man, maybe 20. His left leg was a mangled ruin of denim flesh and shattered bone below the knee. A paramedic was leaning his entire body weight onto the groin, desperately trying to compress the femoral artery. But bright frothy crimson was pooling rapidly on the white sheets, dripping onto the floor in thick, heavy splatters. "Bay 2, Harper commanded. Her voice wasn't loud, but it carried a strange, heavy acoustic weight that cut through the shouting. The paramedics, instinctively recognizing authority, wheeled the gurney into the bay. Chloe was standing in the corner of Bay 2, staring at the ruined leg, her hands over her mouth, completely frozen. Chloe, grab the heavy trauma shears and a tourniquet. "Now," Harper said, moving to the side of the bed. Chloe didn't move. She was hyperventilating. Harper didn't repeat herself. She stepped into the pool of warm liquid on the floor, her rubber soles gripping the linoleum. She reached to her own scrub waistband, pulling a pair of matte black titanium trauma shears she kept clipped out of sight. "Move," Harper told the paramedic. "I can't, he's bleeding out. I have it. Move." Harper shoved her hand directly into the slick hot ruin of the upper thigh, bypassing the surface tissue, her fingers digging brutally deep until she felt the hard ridge of the pelvic bone and the pulsing severed hose of the artery. She clamped down with her fist. The bleeding slowed to a sluggish weep. With her free hand, she used the shears to rip the rest of the denim away. Dr. Hayes appeared in the doorway, breathless, having abandoned the chest trauma to another attending. "What are you doing?" he screamed at Harper. "You can't just blind clamp an artery. You'll cause nerve damage. Get out of the way." Harper didn't look at him. She looked at the patient's face. Gray, lips blue. He was circling the drain. "He doesn't have a blood pressure, doctor. If I let go, he dies in 30 seconds. I need a cat tourniquet, high and tight, and I need you to prep for a central line." Hayes froze, staring at the sheer volume of blood on Harper's arms. We need to get him to surgery. Surgery is 10 minutes away. He has 2. Harper's voice dropped an octave. It was no longer the voice of a quiet, slow civilian nurse. It was a bark of absolute, unquestionable command. "Get me a tourniquet, Hayes, now." Hayes blinked, completely derailed by the tonal shift. He scrambled to the cart, fumbling with the plastic wrapper of a standard-issue blue rubber band. "Not that—" Harper snapped, her jaw clenched tight. "The combat tourniquets, bottom drawer, the black ones with the windlass." Hayes found it, tossing it to her. Harper caught it one-handed. She threaded it around the thigh with a violent fluid motion, securing the Velcro, twisting the plastic rod until the fabric bit deep into the skin. She locked it in place. She slowly released the pressure from her fist. The bleeding stopped entirely. "Line him," Harper said to Hayes, stepping back, wiping her bloody gloves on a towel. Hayes stared at her, his mouth slightly open. He looked from her hands to the perfectly applied textbook high junctional tourniquet. Where did you learn to do that?" "Line him, doctor," Harper repeated, her eyes cold, dead flat. "Before he codes." By the time the surgical team came down to retrieve the patient, the ER was a disaster zone. Blood tracked across the floors, wrappers littered the bays, and the smell of copper was suffocating. But the patients were stabilized. Harper stood by the sink in the staff break room, scrubbing her forearms with harsh iodine soap. The water swirled pink down the drain. Her hands were shaking, not from fear, but from the adrenaline crash. She hated this feeling. The electric buzzing under her skin, the sudden sharp memory of rotor wash, and the smell of burning sand. Brenda walked in. She looked exhausted, her scrub top stained. She stared at Harper's back. "You didn't chart the tourniquet application," Brenda said. Her voice lacked its usual bite, replaced by a wary suspicion. "I'll do it now," Harper said, drying her hands, keeping her back turned. "Dr. Hayes said you pushed him out of the way, said you were reckless." Brenda crossed her arms, leaning against the door frame. "He said you acted like a cowboy. We have protocols, Harper. You can't just maul a patient because you panicked." Harper turned slowly. She looked at Brenda. She felt the heavy, dark exhaustion settling back over her bones. The wall was going back up. "The patient is alive," Harper said quietly. "That was luck," Brenda scoffed, though her eyes darted nervously away from Harper's gaze. "You're lucky you didn't kill him. I'm writing you up for insubordination and breach of protocol. You're a liability." Harper just stared at her. A liability. She almost laughed. The irony tasted metallic in her mouth. "Write it up," Harper whispered, walking past Brenda toward the door. "Just spell my name right." She walked back into the hallway, the fluorescent lights buzzing their relentless flat note, wrapping herself back in the quiet, suffocating cloak of the slow, incompetent new nurse. It was easier to let them think she was dangerous and lucky, because the truth, what she actually was, what she was actually capable of, would terrify them. Suspension without pay, pending a full review. The words hung in the sterile, windowless office of David, the director of nursing. The room smelled like ozone from the constantly running laser printer and stale cinnamon potpourri. Harper sat in a stiff, upholstered chair that dug into the back of her thighs. "You understand, Harper, that we cannot tolerate vigilante medicine," David said, tenting his fingers on his laminate desk. He was a man who hadn't touched a patient in 15 years, his scrubs perpetually creased and immaculate. Dr. Hayes filed a formal grievance. Brenda corroborated it. "You bypassed the attending physician, assaulted a patient, and operated outside your scope of practice." Harper looked at the wall behind David's head. There was a framed motivational poster about teamwork. The corners were peeling. "The patient retained his leg and his life," Harper said. Her voice was flat, devoid of the defensive heat they were waiting for. Brenda shifted in the seat next to her, crossing her arms tightly. "That is not the point. You got lucky. You are a probationary nurse with 6 months on the floor acting like you run the trauma wing. It's arrogant, Harper. It's dangerous." Harper closed her eyes for a fraction of a second. She felt the familiar heavy fatigue settling deep in her marrow. The exhaustion wasn't from the long shifts. It was the crushing weight of constantly translating herself into a language these people could understand. They saw arrogance. They didn't see the thousands of repetitions, the muscle memory burned into her hands under enemy fire, the faces of the men she couldn't save, haunting the dark corners of her apartment. They just saw a protocol violation. "So what happens now?" Harper asked. David adjusted his glasses. "Turn in your badge. The review board meets on Thursday. I highly suggest you bring union representation." Harper nodded slowly. She didn't fight. She didn't explain. She reached up to unclip the plastic ID badge from her collar. Then the floor vibrated. It wasn't the deep structural rumble of the factory explosion from days ago. This was rhythmic. A heavy concussive thwump, thwump, thwump that rattled the fluorescent light fixtures and made the water tremble in David's plastic cup. Harper stopped. Her fingers hovered over her badge. Her breath hitched, catching sharply in her throat. That wasn't a civilian life flight. The rotor wash was too heavy, the engine pitch too deep. That was a UH-60 Blackhawk, and it was landing on their roof. The emergency pager on David's desk erupted, spinning in circles as it vibrated against the wood. He snatched it, his eyes widening. Code yellow, incoming military transport, ETA. He looked up pale. They're already on the pad. Military! Brenda stood up her chair, scraping harshly against the carpet. We aren't a designated VA or military trauma center. Why are they here? Closest facility, David muttered, already moving toward the door. Joint training exercise off the coast. Something went wrong. Let's go. Harper didn't wait for permission. She followed them out of the office, the suspension forgotten in the sudden electric shift in the air. The ER was already devolving into panic. The elevator doors from the helipad bay slammed open. The smell hit the hallway before the stretcher did. It was a visceral metallic punch to the gut. Aviation fuel sweat salt water and the sharp chemical tang of cordite. It was the smell of Harper's nightmares. It was the smell of home. 5 men burst through the doors. They weren't paramedics. They were massive, clad in dripping wet, dark tactical gear plate carriers and helmets with night vision mounts. They moved with a terrifying synchronized aggression, shoving an orderly aside to clear a path for the tactical stretcher. Trauma Bay 1 move, the lead operator roared. His voice was a physical force, cracking like a whip. He was covered in dark, viscous blood from his chest down to his boots. Dr. Hayes stood near the nurse's station, completely frozen. His coffee cup suspended midair. Who? You can't bring weapons in here. Shut up and get a goddamn chest tube ready, the lead operator barked, slamming the stretcher into Bay 1. Harper stood by the edge of the central desk. Her heart was hammering against her ribs, a violent, desperate rhythm. She recognized the gear. She recognized the unit patch on the lead man's shoulder, a subdued trident-bearing skull. DEVGRU. On the stretcher lay a younger operator. His face was ash white, his lips a shocking cyanotic blue. A massive piece of sheared steel from a ship hull was protruding from his upper chest, just below the clavicle. It was a tension pneumothorax complicated by a massive penetrating trauma. He was drowning in his own blood. Hayes finally snapped out of his shock, rushing into the bay. Chloe was cowering in the corner, holding a tray of bandages like a shield. Okay, let's get a look. Hayes stammered, his hands visibly shaking as he reached for the steel plate. Don't touch that, the lead operator snapped, slapping Hayes's hand away with brutal force. You pull that, you open the seal, he bleeds out in a minute. We need a thoracic surgeon, and we need him tubed now. I am the attending, Hayes's voice cracked. He was out of his depth, drowning in the aggressive, terrifying energy of the room. You need to step back and let me work. You're shaking like a leaf, Doc, another operator growled, pressing a blood-soaked gauze pack against the patient's neck. You touch him, you kill him. Where is your trauma lead? I am the trauma lead, Hayes shouted, panic bleeding into his tone. He grabbed a laryngoscope, preparing to intubate. But his hands were trembling so hard, the metal blade clattered against the patient's teeth. The lead operator stepped forward, grabbing Hayes by the collar of his scrubs, physically lifting the doctor onto his toes. I will not let you kill my guy. Get someone in here who knows what the hell they are doing. Put him down. The voice wasn't loud. It wasn't a scream. It was a cold, heavy command that sliced straight through the adrenaline-soaked chaos of the room. Everyone in Trauma Bay 1 froze. Harper stepped through the glass doors. She didn't look at Brenda, who was standing in the hallway, mouth agape. She didn't look at Hayes, who was currently suspended by his collar. She looked strictly at the lead operator. The massive man turned his head, his eyes wild and furious beneath the brim of his helmet. He looked at the slight, quiet nurse in the cheap polyester scrubs. He blinked. The fury in his eyes fractured, replaced by a sudden, jarring shock. "Chief," he breathed. Harper stepped up to the stretcher. "Let the doctor go, Miller. He's no good to me with a bruised larynx." Miller slowly unhanded Hayes. The doctor stumbled backward, crashing into a supply cart, gasping for air. Miller stared at Harper, completely ignoring the hospital staff. "Doc Harper, what the hell are you doing in Ohio? Trying to live a quiet life," Harper said. She pulled on a pair of sterile gloves, her movements precise, deliberate, and entirely devoid of hesitation. The wall was gone. The box was obliterated. The chief was back. "Report." The shift in the operators was instantaneous. The aggressive feral panic vanished. They straightened up, falling seamlessly into a subordinate, disciplined rhythm. They had their medic. They had their doc. Shrapnel from a hull breach during a VBSS drill. Miller reported, his voice crisp and professional. "Penetrating trauma, right upper quadrant. We pushed 2 units of whole blood on the bird. He's tensioning, Chief. Airway is compromised by swelling." "Hayes," Harper commanded, not looking at the doctor. "I need a 36 French chest tube, a scalpel, and a Kelly clamp. Chloe, push 50 of ketamine and 50 of rock. We are doing a surgical airway. His jaw is locked." Hayes was paralyzed. You can't, the protocol." Miller took a half step toward Hayes, his hand dropping to the sidearm strapped to his thigh. It was an unconscious protective movement. "The chief gave you an order, doctor." Harper didn't wait. She reached across the tray, grabbing the scalpel herself. "Miller, hold his head dead center. Do not let him flinch." "Got him, Doc." Miller braced the wounded man's skull with massive blood-stained hands. Harper pressed her fingers against the patient's throat, finding the cricothyroid membrane. She didn't shake. Her pulse was a slow, steady drumbeat. This was the dark, brutal mathematics of survival. She made the vertical incision. Blood welled up dark and heavy. "Suction," she ordered. Chloe, crying silently, handed her the suction tube. Harper cleared the field, made the horizontal cut, and shoved the breathing tube directly into the man's trachea. She secured it in less than 15 seconds. "Bag him," she told another operator. The man immediately complied, squeezing the plastic reservoir. The patient's chest rose. The awful, wet, choking sound stopped. "Chest tube," Harper said, holding her bloody hand out toward Hayes. Hayes stared at her, terrified, entirely broken by the absolute authority she commanded over these terrifying men. He fumbled with the packaging and handed her the plastic tube and the clamp. Harper moved to the patient's side. She didn't wait for local anesthetic. The man was unconscious, dying. She made a deep incision between his ribs, shoved her gloved finger into the pleural space, and pushed the tube in. A violent hiss of trapped air and a rush of dark blood exploded into the collection canister. The monitor, previously screaming a warning of impending cardiac arrest, slowly began to level out. The erratic spikes smoothed into a steady rhythmic beep. Harper stepped back. She stripped her gloves off, dropping them into the biohazard bin with a soft thwack. She looked at her knuckles. The silver scars caught the harsh fluorescent light. "He's stable," Harper said quietly. "Keep him bagged until the surgical team gets down here. They'll need to crack his chest to remove the steel, but his vitals are holding." Miller let out a long, ragged exhale. He reached up, pulling his helmet off, revealing sweat-matted hair and a face lined with exhaustion. He looked at Harper, a profound, heavy respect softening his hardened features. "Thank you, Chief," Miller said softly. "We thought we'd lost him." "You did good holding the pressure, Miller, just like I taught you in Kandahar." Harper offered him a tight, fractional smile. It was the most genuine expression anyone in that hospital had ever seen on her face. The glass doors slid open. David and Brenda stood there, flanked by hospital security, who looked entirely unwilling to enter the room. David stared at the blood, the operators, and finally at Harper. What just happened?" Brenda whispered, looking from the giant Navy SEALs to the quiet nurse she had just tried to fire. Miller turned to Brenda, his eyes narrowing. He looked her up and down, taking in the clean scrubs and the clipboard. "What happened is your nurse just saved my teammate's life. You people have no idea who you have working for you, do you?" Brenda swallowed hard, stepping back. Harper picked up a fresh pair of gloves. The adrenaline was receding, leaving behind the cold, familiar ache in her bones. She didn't feel triumphant. She just felt tired. She looked at David, who was staring at her, as if she had suddenly grown a second head. "David," Harper said, her voice dropping back to its usual quiet cadence. "Yes," David squeaked. "Am I still suspended?" David looked at the 5 heavily armed, intensely protective Navy SEALs standing around Harper, glaring at him. He swallowed audibly. No, Harper. The review is canceled." Harper nodded. She turned back to the sink, turning on the cold water. She scrubbed her hands, watching the pink water swirl down the drain. The ER was quiet again, save for the steady beep of the monitor. They wouldn't mock her anymore. They wouldn't call her slow, but they would fear her, and in some ways that was infinitely heavier. She dried her hands, the rough brown paper shredding against her palms, and walked back out to the floor. Her shift wasn't over yet. If you felt the tension in that trauma bay and loved seeing Harper finally unleash her true skills, smash that like button. Stories of unsung heroes hiding in plain sight are our absolute favorite to tell. Don't forget to share this video with your friends who love intense medical drama and military respect, and make sure to subscribe to the channel so you never miss a pulse-pounding story. What should Harper's next shift look like? Tell us below.